Hello everyone, this is Arif Khan Pathan. We will discuss today about the antiseptic and disinfectants. So, as far as the antiseptic and disinfectants are concerned, the popular term comes, that is chemotherapy. Now, what is chemotherapy? The study and use of chemical substances which are selectively more toxic to the infective organisms than the host. It means that use of the chemical substances to kill or inhibit the growth of microorganisms, infective organisms, to prevent the infection. So use of these chemical substances are called as chemotherapy. Chemo stand for using chemical, therapy that is the to kill or to cure the infection. Now these chemotherapeutic agents will be a synthetic antibacterial agents are divided into two groups such as systemic and local or topical. Now if you're talking about the first systemic antibacterial agents, so they will be divided as the following: sulfonamides, antibacterial agents, and the agents used in the treatment of urinary tract infection. So next that we are going to discuss, that is anti-infective agents, and particularly these are local anti-infective agents. So the antibacterial agent used topically or locally are known as local anti-infective agents. So the following are the examples: antiseptic, disinfectants, preservatives, and sterilizer. It means that our topic is antiseptic and disinfectant. So this term are actually the local anti-infective agents. Antiseptic and disinfectants are local anti-infective agents. In addition to that, preservatives are again there. So one by one we'll see all these four local anti-infective agents. Amongst these, first is antiseptic. So as far as the definition of antiseptic, the agent that kills or inhibit the growth of microorganisms, and when they are to be applied on living tissues, are called as antiseptics. Thus, they prevent the formation of sepsis. Means sepsis is the formation of pus. So pus formation is one of the step of infection. After the infection, if it is progress not to be cured, so it results into formation of pus, and that is called as sepsis. So it means what? We want to prevent the formation of sepsis. It means we have to prevent the progress of infection, and for that we have to kill or inhibit the growth of microorganisms which may able to produce the infection. So we have the example of antiseptic, that is benzoic acid and ethanol, and these antiseptics are normally applied on the living tissues in the form of various dosage forms such as mouthwashes, gargles, soaps, and preparations for minor wounds and burns such as antiseptic creams. Now the antiseptic lotion, antiseptic cream, as well as the antiseptic solutions, we are much familiar with this, the use of antiseptics on the cleansing of wounds. Next, disinfect. Next, local anti-infective agent, that is disinfectant. So as far as the definition, the agent that kill vegetative bacteria, that is microbes, but not necessarily their spores when they are used on inanimate object. The major difference between the antiseptics and the disinfectant is that the antiseptics are applied on living tissues, whereas these disinfectants that we have to apply on inanimate objects, that is the non-living tissues. So this is the major difference. The chemical substances, when we are applying on living tissues, we are calling antiseptics. When we are applying on the non-living tissues, that is inanimate object, then we have to use the term disinfectants. So we have the popular example of the disinfectant, that is phenol and formaldehyde. Next term, third term, which is a local anti-infective agent, that is preservative. Name itself indicating that they are preserved. They will preserve the formulations. The agent that prevent the biological destruction of material or pharmaceutical preparation are called as preservatives. Means we have to use these substances to prevent the biological growth, or particularly the growth of microorganisms, which may lead to biological destruction of the formulations. These are called as preservative. Normally preservative we are using in formulations, such as the best example of benzoic acid, normally we are using the solid dosage forms, whereas benzalkonium chloride in the parentals or injectables, which will preserve the destruction, particularly biological destruction of preparation. Now next and last term, which is an local anti-infective agent, that is sterilizer. So the agent that must destroy all forms of life, including spores, viruses, and fungi, are called as sterilizer. Means the sterilizer will make completely free from microorganism. Sterilizer will make the object completely free from microorganism. It will not leave any microorganisms on the surface. Kills all forms of life of microorganisms. Example, we have ethylene oxide, and in image you can see that there is a say ethylene oxide sterilization chamber. Actually ethylene oxide is a gaseous sterilizer which will able to kill the all forms of microorganisms. So normally the sterilizer in the form of gases we are applying in the chamber. So the object that we have to make it free, completely free from microorganisms, that we have to keep in this EO sterilization chamber, where which the ethylene oxide gas to be exposed to the object, and that gas will kill the microorganisms and make the surface completely free from microorganisms. Next, the classification of antiseptic and disinfectant include first class, that is phenol and related compounds. Phenol, we have example of this phenol and related compound, that is phenol itself, example chlorocresol, chlorozionol, hexachlorophene. Alcohol and related compounds, ethanol, isopropyl alcohol. Then aldehydes, formaldehyde we have example carboxylic acid derivative, benzoic acid, methyl benzoic acid derivative, that is methyl paraben, para-amino benzoic acid derivatives. These are the examples. Again, halophore, in which chlorine containing chlorophore, iodine containing iodophore. Fluorophore we have example chloramine T. Iodophore we have povidone iodine iodoform. Next, heavy metal containing, in which mercury containing organic mercurial, thiomersal is example. Silver containing, silver again a heavy metal. So silver containing antiseptic and disinfectant, example silver sulfadiazine, silver protein. Next, cotton ammonium compound, which is called as cationic surfactant, which are surface active agents, maybe detergent property they have. Benzalkonium chloride is the best example. Then the dyes, proflavin, brilliant greens, all these are acting as antiseptic and disinfectant. This is the chemical classification to which chemical class they are belonging. So we are classifying again. Miscellaneous, topical, nitrofurazone, ectamol. Urinary antiseptic, nitrofurantoin. 1,4-dihydrophenol derivative, norfloxacin, ciprofloxacin. Now we are moving towards the first example amongst the antiseptic and disinfectant, that is proflavin. So this is the chemical structure of proflavin, in which the parent nucleus, the numbering is given to parent nucleus, the three-membered ring, which is a sandwich ring, that is called as acridine, and two amino groups are there at 3 and 6 position. So in this the whole structure will divide into two parts, parent nucleus and the substituent. The parent nucleus is the middle ring, three ring fused together, that is the pyridine ring is sandwiched between two benzene ring, and the complete tricyclic ring we are calling acridine. We are giving numbering to the acridine as per the numbering pattern. Then we'll see there are the two substituents at 3 and 6 position, and both are amino. That's why we are writing the name acridine 3,6-diamine. Now physical properties of proflavin is concerned. The color is orange red. Actually it's a orange red color drug, odorless, none, doesn't have any taste, crystalline powder, sparingly soluble in water. Now if you are discussing about the chemical properties of proflavin, so when it is treated with potassium ferricyanide in slightly acidic medium, it is precipitated as ferricyanide salt. So potassium ferricyanide when react with HCl, that is in acidic medium, it means that it will react with a HCl and it will form hydrogen ferricyanide. That hydrogen ferricyanide will further react with the proflavin, that is our drug, and it will form the salt of proflavin ferricyanide. Next, stability storage condition of proflavin. It should be stored in tightly closed light resistance container. As a uses as a slow acting antiseptic, effective against the many gram positive and gram negative bacteria, which able to kill many gram positive as well as gram negative bacteria. It is used in the treatment of infected wounds, for the dressing of wounds, for the treatment of local infections of external ear, mouth, throat and the skin. Last one formulations are proflavin cream, and brand names are proflavin itself a brand, Progesic and Progen. These are the brands for the given drug, that is proflavin.